So I'm grateful to be here today. I always support Missouri Breaks, everything that they do as well, and I'm just glad to be here today.
Good afternoon, my name is Kaylani. I'm actually a senior this year at Shining View. I've been interning with Missouri Breaks for over a year now, so I'm getting a little bit into the research and getting a little bit of experience with that, so I'm grateful to have this opportunity today. Thank you.
Good afternoon, I'm Dr. Jordan Gunville-Puyer, and I am from this community, and so I started doing health research many years ago in grad school. I was a Susan G. Komen Scholar, and so I got introduced to cancer disparities through a training fellowship, and through that understanding of a clinical outcome and what those outcome measures were versus our measures in the community, they often didn't align for what was needed at the community level. So that has really was the driving point for me to get my PhD in health policy management, because I really wanted to understand access to care and referrals. And so through there, I was a Robert Wood Johnson Health Policy Research Scholar, which gave me the ability through my dissertation work to do a community-based participatory research dissertation. And so that has really grounded me in health, in the work that I do in my community. And I've had the privilege of coming home during grad school to work in our community and provide services in different ways. Thank you.
My Lakota name is Common Goodheart, and my English name is Courtney Clausen. Some of you might know me as Courtney Fisher. I grew up here, graduated in 2012, so it's really good to be back. I'm back just about every other weekend to help with things that are going on back home, and my little one is actually spring breaking it here with Unchi, so just really grateful to be here and honored to have been asked to speak today. I'm also Dr. Courtney Clausen. It's a new title for me. I graduated from the University of North Dakota PhD program in Indigenous Health last fall, and I've been working with the Johns Hopkins Center for Indigenous Health for a little over a year now. Some of my early experiences into research really kind of started as a summer undergraduate research experience. Student, intern, really got to kind of dive into the world of research and see just really how multifaceted it can be, and how many different areas you can really look into, and then further develop my passion for culturally competent but culturally safe and culturally grounded research, and the importance of really bringing our lived experiences, our knowledge systems, and Lakota ways of knowing into the ways that we are moving in community, and really just being a good relative in all the work that we're doing, and making sure that we're carrying ourselves in a good way. The research project that I'm part of right now is called Together Overcoming Diabetes, and it's a culturally grounded, Lakota-specific, family-based intervention, and it's been a really great program to be part of over the last year, but again, just grateful to be here. Wopila for having us.
Good afternoon, my name is Kelsey Haskell. I am a District 4 Council Representative and a business owner. I really wasn't involved in research prior to Tribal Council and being seated on the Health Committee. Now I get to see it from start to finish pretty much. I get to see what they come in with, how if we can approve it, if it's approved by an IRB, and then any modifications that we'd like to make it more culturally appropriate for us in terms of age, gender, the research they want to do on any of our children, we get to change that. So I'm more involved than I've ever been. It was never a passion of mine, but it's interesting now.
I'm Joan Upel. I'm a retired K-12 educator and currently part-time OLC adjunct instructor. I am a member of the Community Advisory Group for Missouri Breaks, and also to volunteer work with KF Foundation, specifically the Communities That Care Coalition. And so I've seen research in all sorts of ways. Thank you very much.
My name is Sandy Frazier, and I'm a retired counselor. My last 15 years were working for the BIE. I retired when I was 62. We created a nonprofit, the 100 Horses Society, and it's located in Dupree. And so far we're in like 3 communities, and we touch base with the other communities on the reservation. And a lot of what I saw today with the presentations are things that we know are important for our women to know. We have teaching, we teach foods, we harvest herbs and other things. She has sewing classes. She has classes for the elderly women, and she has classes for the children over there and in a couple other communities. And we know that this is what we need in order for our people to continue that transition out of colonialism into who we are, to be the very best that we are, and we know we are. And we have to instill that in our children, and our grandchildren, and our great-grandchildren. In next month, I'm going to be 80 years old. And 2 years ago, I almost died. My diabetes caught up with me after 40 years. I had no idea. I did my appointments, was always told I was doing pretty good. I was active, especially with 100 horses, hauled a lot of teepee poles, did a lot of physical stuff. And when that slowed down, the diabetes just came and got me. And the thing that I found out was that in all the things that the doctors talked to me about over the years, no one had ever put any emphasis on vascular health, except for the eyes. They always say, you could go blind. But nobody ever said that same vascular system's gonna make you lose your toes and lose your foot. And that's one thing I'm hoping to recommend through this committee or that we look at that as a research project, because I saw too many cowboys going around in a wheelchair when they should be on a horse. And I thank you all for coming today. This was a really great turnout. Awesome speakers, good knowledge, good sharing, lots of good questions. So thank you.
Thank you. It takes a village, right? It takes all of us. It takes different interests, different perspectives, different reasons, different whys. And so we appreciate you all. So from your perspectives, and this question is to any of you who would like to answer, from your perspective, why do you think research is important to the growth and development of our community?
I think it's important because normally, or I should say previously, we were never included in any of the studies, and they did not pertain to us. Like today they were saying that when they finally studied how much diabetes there really was among us, or among heart disease, the numbers were big, and we didn't know that. We weren't told that. We knew from watching our neighbors and our families. And so my mother, who died when she was 3 months away from 90, took part in the Strong Heart study when they first started. And she encouraged the whole family. And I'm part of the Arpan and the Walters and the Balker family, so a lot of us. She encouraged us to take part in the Strong Heart study. She said, maybe they'll find something that will help us. And so she was always an active participant. So it's important for us.
Lindsay, I think it's important because one of the things I've learned while being on the health committee is that studies are generally done on white males and nobody else. That's historically what they've been done on. But some of the things I've learned while being on the health committee is that we think it is a race issue, when in reality it could be a geographic issue. And like everything would pertain to everybody around us and not just Native American, white people, black people, but the people on Cheyenne River itself. So that I'm interested to see some of the outcomes of any new studies regarding geographics and not race.
I think it's just, oh, thank you. I think it's just important too to note that when research is conducted by and with Indigenous populations and with Lakota peoples, the questions are different, the priorities are different, because we know that those who we're conducting research with are our relatives, they're, you know, our young ones, our unchis and grandpas, and I think it's just really important that when coming into communities and you're from the community, that's not always the key either. It's really knowing that it's important to recognize within yourself what are the reasons that you want to conduct research. And a lot of times when you hear from Indigenous researchers, it's because, you know, well, my grandma, you know, had type 2 diabetes. My great-grandpa had type 2 diabetes. And so you see a lot of these connections that are a lot more meaningful than, you know, just research for the sake of research. And I think that reciprocal practices are often conducted too, and you see that, you know, within Missouri Breaks, you know, like the reciprocal practices of giving knowledge back and doing that in meaningful ways. And I agree, I echo that a lot of the presentations we've seen today are just so incredible, between, you know, the Unchi kitchen and getting to see practices from that perspective, and all the way up into making sure that we're being considerate of our lung health issues that are happening. And so it's just really beautiful to be in this space and to get to hear all of the really great research that's happening by and with our community members.
I think for me, for research is very important because everything evolves. You know, the world's continuously going to evolve, the community is going to evolve, but it's trying to research the different methods of how we approach certain, I guess, negative social factors we're seeing. I'm sure the way that we treated alcohol and drug addiction in the 90s is not effective today because addictions evolve. Well, now the social dynamics of our communities, their children evolve, their interests, their understanding, their music evolve. I'm pretty sure the music my children listen to today is going to be, the music my wife and I listen to is probably going to be lame to them, you know? So it's trying to look at the community and the reality of what we're seeing. So again, that's why the research is important. And again, when he talked about I guess on white men, I don't want to get too negative, but like the clothing's hard to buy for neighborhood. Clint knows, my old coworker is sitting there. It's hard for us to buy clothing, but again, because they did a research on non-native men and they figured out this is the average size for an extra large and whatnot. Well, what works here for the Native American population? And I think we all know the community we see here is totally different than what is out there as well. And plus for the data usage of how can we adapt that data specifically for our communities as well.
Absolutely, thank you. Can you describe what an ideal relationship should look like between a tribal nation and local or university research partners, thinking about roles, responsibilities, communication, data ownership, and etc.?
So at Johns Hopkins, I think one thing we really try to foster, and this is my colleague Courtney and I, we really believe that our community voices are really important. And so in a lot of work that we do, we are really grounded in community priority. And even if we get institutional pushback, right, we hold our grounds and we always make sure that our priorities are at the forefront. And I think that through a lot of the work that we do at Hopkins, we really try to make sure that we are including the community and that we have an understanding of data sovereignty. And when we start any type of project, right, that is always our first conversation, even before we go to any IRB or RRB at the tribal level. We work a lot with state partners. So I do a lot with like third-party billing and access. So that is another way where I always challenge our state partners in South Dakota to say, well, where's our representation? Let's hear them. Let's hear how they use, right? How do they navigate these systems? Because they're the ones who have to walk through the clinic doors and ask for the help. And so I think that it is really essential for the community to be involved in all aspects of research, in all aspects of evaluation, in all aspects of policy.
That's a really big question, Lindsay. Oh. That's a big question, Lindsay. Should have broke that one into two. Okay, so I'm gonna start with the tribe owns the data. Bottom line. I'm also gonna start with transparency. So when you take a client, your initial conversations should be, this is what we're researching, this is what we'll need from you, this is the time that we will need you, any incentives involved with this study, and at any point, if you don't feel comfortable, you can leave. And that's it. If you want to come to the next one, that's fine. The other thing is, if there is a portion of the study you don't want to participate in, that you don't have to. And no hard feelings, like just, you don't have to do it. Which I know you guys do offer. I know that there are parts of studies that people opt out of. What was the rest of that question?
Let's see, I was engrossed in your answer.
Oh, the relationship with tribes.
Yes.
Back to transparency. I think that everything, and I'm gonna use Ray as an example, but when Ray presents a research project to the health committee, she comes in and she says, this is what we're going to do, this is our age range, this is how long it's going to take, this is what we're trying to figure out. And not only does she give us everything on a piece of paper, but she goes over it from start to finish over everything. So that if we wanted to, I have modified an age, so I'm gonna say I didn't want them doing research on younger women, so I made a motion to stop that. I don't know what age I allowed, but I didn't want them going beyond a 12 or something, 14. Because it involved a different stuff I don't think our children should be exposed to, I'm gonna say that. So, I think that, and she wasn't mad at me. She was just like, okay, cool, like we don't, that's the age we're gonna stop. So I like how she presents her projects and how we have a full understanding of like what her project encompasses.
So I can speak from the university aspect when working with tribal communities. And so one best practice that we do is, so typically at Johns Hopkins, we will run the IRB protocols through our in-house, through our IRB institution. And then what we'll do is our community partners that we work with, right? So typically what I'll use, like Pine Ridge, we just had a study go through Pine Ridge. So we went and presented at their RRB. And so then what we do is to have a good relationship and let them know at any time that their participants want to be removed from a study, that is their right. And so we go over that section in a private meeting. We have a line of communication so they understand that. And then I do monthly check-ins. So I'll say, hey, this is where we're at. These are milestones that we may have met this month, and just do that report. And then kind of best practice that we do at Hopkins, so if it is an NIH study like Courtney's, she would do like a quarterly report. So then what we'll do is then we will then take that same report and report that back to the tribe, even though our IRB is ran through our institution at Johns Hopkins, because I think that is the important component of fostering those relationships and then giving that like Kelsey said, the tribe does own the data. And sometimes with these big NIH studies, they do have to sit at certain institutions because that's just how the agreement goes. But we make sure that we are honoring and we are accountable in that way and doing research in a good way, and that they have access to all the information. And anytime that there's any type of change that's being made in the study, a personnel change, we also let them know.
Thank you. What steps do you feel can be taken to ensure research results are actionable, accessible, and lead to positive changes in our community? And if you have any specific examples of how you've seen this done, please share.
No, I think just having gatherings really similar to this. I know a lot of the emphasis too on coming and speaking here today is that this is a community-based presentation structure and really relaying research in a way that's not, just very focused on the incredibly high level academic side of things, but really making sure that you're grounding your research within community and within the people who it benefits and who it's being done with and for. And so just communicating things in ways that are, outside reporting structures, having visuals, having different examples of methods and reports that are able to be used by community members, and then you're able to sit at a kitchen table after seeing the presentation or getting the materials and have a conversation about it because you understand it clearly and that it's very clear on what's being done.
I never even thought I've never seen, prior to health committee, I don't remember seeing the outcomes of a study. I don't know where you would find that information. I don't know what you would do with that information, but just like the Strong Heart study, which has been going on all my life, pretty much, I don't know where those results are. So that's something to think about, where that information is and what anything useful that has come out of that. The other thing I want to say for researchers is I don't even, who's all a researcher here? Who's from all over?
All of us.
Okay. I think it's important that people feel comfortable coming to you, because Native American people are going to be standoffish to anybody who we would consider an outsider. So you need to have a welcoming face, somebody they're comfortable with, and somebody who they will open up to before you're gonna get anybody to participate in anything that you're trying to do. And if you could get one person, and then I could say, hey, Courtney, I went here and they were good to me, and you wanna meet up with Joan, so she could do some research. Just word of mouth and just how you make people feel when they present to you really is a make it or break it situation for researchers. Because Native Americans do not want to be guinea pigs. That's their biggest push away. I'm not gonna be a guinea pig, you're not gonna do this to me. I just refuse to participate. So, you need to have women or other Native Americans in there who can relate to them, who are kind to them, and who make them feel comfortable. If that helps you in your research path in any form or way, I think that's very important.
I've been reading the newsletter every time it comes out, and that's always good information. And, that's something Mom turned me on to. So that's how I see the work of the research. And I like that it's multi-reservation, so I can look at the differences.
And I think it's important that researchers come to the community, not just for an hour or two, but come to the community to get to know the community, because I think there are a lot of ideas about what a reservation community is or isn't, if you haven't had that type of experience.
I think when we look at data, I think that's, Kelsey brought up a big concern, I think, in regards for data. When we look at research, you know, and they compile all the data, they get their findings, and they present it, but what is that, how can I use that? You know, maybe it helped your research project to be completed, then they leave, and I know the tribe owns it, but it's educating people, and that's the smallest form, is educating people in regards to research. Like, again, when we talk about research, we automatically think, oh, that's somebody else, that's not me, but that's the reality of our community. But how do we inform people that every one of us researches every day, every one of us strategically plans every day, whether planning out our day, our morning, we got a meeting coming up here, and using it in a way that our people can connect with. You know, taking this terminology and using it for people to understand. But again, I think one of the most important parts is, and I made mention in a couple of the other presentations that were talked, is as Indigenous, Native American, Lakota people, we understand that the spiritual part is very important. You know, one of the things that they say in our culture, prayer comes first before anything. Well, once you establish that prayer, now you created something. You created something to have a spirit. So the research that is being presented, it's not just coming here and doing whatever research topic that you want to do. You're creating something. It's going to have an impact. So when we make these attempts to try to understand more of this topic or this idea, it's not only data. Now we created a spirit that's going to be living in this community. How are we going to present that for our community members to understand what this data means? You know, and again, using that understanding of cultural awareness or cultural education, but also educating people in regards to research topics that are be happening, like how they brought up the strong heart. You know, it's been here so long. It's, you know, what's the data? But what can I use that for myself? How can we use that? And again, the tribe owns it. How can we use that to empower our younger generation who are pursuing a higher education? We have all the data. Everything is here. The cure is here in our culture. I heard somebody say before, and it is. But how do we relay that to our relatives for them to understand that, to capture that spirit of that data or capture that spirit of that research topic that was being discussed, and how do they proceed with it on? Because I'm pretty sure a lot of this research methods, we'll never see the fruits of it. But we're setting that stage for our children and our takojas to be better than us. And I think that's ultimately what research is to bring something, a solution back for our people.
Wait, what's about pending?
Okay, so what steps can be taken to ensure research results are actionable, accessible, and lead to positive changes in our community?
Okay. As from a youth perspective, it's whenever I see research, or like I'm scrolling on social media and I see something and it's like paragraphs and paragraphs, it's hard for me to want to take my attention to that, just because it's not like, it doesn't attract my eyes. With Missouri Breaks, I've been doing the social media part of it, so I've been helping and getting the demographics and posting on YouTube, social, like all of our social media platforms, and I think that attracts more of the youth's attention rather than just the papers that you have to fill, or the final papers or whatever. But I think just like breaking it down a little bit and not doing just like papers, like a long paragraphs, but doing like little demographic here and then like another demographic in a couple weeks, and just spacing it out. That way they're more intrigued and they have to wait a little longer. It keeps their attention and keeps them engaged with it. I think that helps a lot more with like the results and getting out into the communities for the youth. And I think it also helps to, like, if it gets to the youth and they can help their moms, their grandparents, their siblings, their cousins, they can help them understand it. That way, if at least one person understands it, they could go and tell someone else, and then it just spreads. So I think whenever we're talking about the results and how to display and stuff, I think social media, it has its good and bads, but I think using it in a good way and like helping with the results and like spreading it that way, I think it gets a lot more attention than I think people think.
Kaylani, can you talk about the website projects page that we're working on? or that you're working?
Yeah, so Ray said to ask or talk about the website projects, and I've been doing that. It's the study archive, and I've been working on getting the paperwork that we need and posting or getting it ready to be publicized, so that the public will be able to go and it'll have the consent forms, it'll have the information, it'll have every like the demographics. It'll talk about, it has, each study has a page. Like for example, I just finished one about HPVs, and if you look it up, I think it's public to people now. If you look it up, it talks about the study. It has a brief summary of the study, and it has all the paperwork that needs, the consent forms. So like if someone was in the study and they don't remember, they could click on the link to the consent form and read it, and then hopefully then they'll be like, oh yeah, like I did this. It talks about the study, the findings, if there was articles written about it, magazine articles, like it talks about that. So there's more. I think there's 4 that we've done so far, and there's still more that we have to go through and get the right paperwork and everything. But that's also another resource that people could use to see all the results from the studies that were previously done.
Yeah, Kaylani is doing a really awesome job at putting it into a format that is easily accessible, which is exactly what we've been talking about. How do you all find these things? There is a paper in the back on the table near the door with Mr. Blaine O'Leary up there, it was up there anyway, that has the website information on it. So feel free to grab it, check it out, definitely. All right, so this room is full of eager local researchers and experts from all over the United States. What are some pressing issues or areas of concern in our community that you believe should be prioritized now and in the future? So pressing issues or areas of concern for our community that you believe should be prioritized now or in the future.
That's deep too.
Yeah. Perfect.
So I think something that needs to be an issue that needs to be, I guess, identified and like it's really worked on is evolution. You know, only reason why I say evolution is because everything changed. Our social dynamics in the community has evolved. Our understanding of our culture has evolved. Our understanding of the method of teaching Lakota language has evolved. So again, I think those are factors that are contributing to our environment, but that's impacting to the development of our children. You know, and again, my biggest thing is always the children come first. You know, and trying to what stage are we setting for them so they can be that much more better than us. But again, understanding that the community, the negative social factors they're exposed to, or the things that they're experiencing, that's really contributing to their behavior, their emotional development, their mental development, their even down to their spiritual development as well. We see a lot with that, with the culture part of it. You know, seeing younger generation who want to know, but they only want to do a little bit because maybe there's something that a trauma that they might have experienced or trauma that they've seen. But it's empowering. You know, so when I talk about evolution, it's empowering our community members to really look within. You know, we talked about this before at one of our cage meetings, was advocacy. A lot of our people don't know how to advocate for themselves because of the dependency level what our community is facing here. So, and again, if I have a stomach ache, normally I'll just go to the hospital, the doctor says, here, take this pill, it's gonna go away. Not asking what the effects of that pill, I'm gonna trust this doctor, I'm gonna take that pill, and if it gets worse, maybe my kidneys shut down, now I'm in dialysis. So again, it's advocacy, really empowering people to use their voice. And not everybody is the same in our community. And again, everybody has a unique purpose in this world for whatever it is. You know, looking at the college level, Clinton, Gladys, and myself, you know, we've seen it, man. Not everybody came in as a business major. Not everybody appears pursued the same avenue of education or interest in the community or occupation. We're all unique. So again, it's trying to make that approach as well.
Also, more information about our reservation presented by us. And I'll tell you a little story. We had a sister that was at the Catholic Church, and she lived here in the community for a good 10, 15 years. And so she did her sister work in the church, and she would go back every night to where they stayed, and she never interacted with the community. she became friends with my sister Rosalita. And one Easter, I said, Rosie, why don't we invite your friend, the sister, to come eat with us? She couldn't even find my house in the community because she didn't know. And she had lived here all this time. So that was the beginning. After that, we included her and another sister that was down there. And we started inviting them. And before she left the reservation, she was babysitting for someone who had gone to the hospital and had spent 2 or 3 days in the house. So it changed her. And that happens not just with scientists, that happens when our doctors come and they're here, our nurses come, that there's no interaction with our community, there's no interaction with us, because there's no safe places for us to interact like that. Missouri Breaks is one of the places that can do that, obviously. You just heard a testimony of it. And that's the way it can happen, because Missouri Breaks is long-standing in our community and trusted, and they would know how to do that with the scientists that want to do things.
I would like to add too, I know we're probably almost done here, but besides doing like the kitchen stuff, Missouri Breaks did yoga that they were able to participate, like anybody could participate in. So that's another like bridging that gap to the community and getting our community members involved. But I think that the kitchen is huge. Teaching people how to cook. Just on Sunday, one of my employees was like, Kelsey, where did you learn how to cook? And I'm like, how do you not know how? Like, just throw anything in a pan and, throw some salt in it. It's good. And I don't know how, because they grew up no different than me, They grew up in this, I should say, the same household as me, but they just never got involved in cooking, and they had the same resources I did. I know that because I know her, and she just didn't take an interest in it. So, and then I have family that could go to Missouri Breaks and learn how to cook some stuff. But that's a way of bridging that gap to the community members and making them and taking them into an environment where they feel safe, they're learning, they're around other people. And what else do they do besides yoga? Yoga, cooking, those are the two that I can think of.
We did
But-
paint parties.
What's that?
When Noni, remember we had paint parties, we did all different mental health stuff, not just yoga, there was a bunch.
Painting parties,
Cradle boards and beading, opposites and stuff for moms and stuff.
beading, cultural stuff, making cradle boards. I think one of the most important things that researchers need to know is what Kehlani said about being able to read and being able to comprehend what's on that piece of paper is very, very important. Whether it be colors or graphs or statistics, not just a bunch of words that mean absolutely nothing to the average person. And that is probably, that's huge. Huge, huge. Make it bright and colorful and straight to the point, and I do think graphs and statistics add to it though. But she's a social media artist and I'm not. She's good at that stuff.
I think just to kind of add on the question that was asked in regards for bridging that gap, I think as Lakota people, we're always taught that a term that we're all familiar, we hear it many times, is Ikjewichasha, or Ikjewiya, the common man or common woman. That is really rooted into our culture of who we are as Lakota people. So we understand that in that term, how it translates is that nobody's greater, nobody's less. We're all equal. And then that goes back to the fundamental ideology that we're just human beings, despite the demographics or the area we come from, despite what credentials we might have. At the end of the day, we're just human beings. So again, it's trying to always have that approach. So it's trying to understand how they're going to be more effective of bridging that gap. It's just going and participating in an activity at Missouri Breaks. There's all kinds of activities going in the community, or just going and seeing there's a big crowd at the track. Maybe there's an autism awareness walk happening, going over there participating in that. One of the things I've come to understand through the cultural part of it is that uglakapi, socialization. Socialization as a human being validates our existence. Whatever credential we have, whatever background, whatever childhood we come from, by socializing, we get to understand each other more. And that will help to bridge that gap. That will help to provide that education, like you said, the credentials that you have. You have this platform that you can help these people, our people, understand more. And, you know, establishing that communication, what you're doing is, I heard somebody mention earlier, is now they become advocates. Because now they're going to understand research more, or a certain topic more. So when they go home, they're going to tell their families. Then they go to their social groups, they're going to tell their social groups. And that's how we bridge that gap. But again, it ultimately just getting back down to the level that we're all human beings. We're only here for a short period of time, and what are we going to do that's going to impact our community, our people as a whole? So again, it's always trying to understand that rather than coming in with, I have this credential, I'm this, I've done all this stuff. You know, hey, I'm just a human being. I want to understand you more. You know, and visiting. You know, that's Boglakapi, basically.
Wonderful, thank you. We thank you guys so much for coming and sharing your opinions and thoughts with us.